and insight. And so I just thank you so much. Thank you so much.
Thank you. So good morning, everyone. Thank you for joining us. My name is Atia Thurman, and I am joined by my esteemed colleague, Cynthia Williams.
Morning.
So the coronavirus has exposed glaring health and economic disparities among community of colors. It has proven particularly dangerous, though, for African Americans. According to CDC data, 1/3 of people who are hospitalized from COVID-19 are African American, yet we only account for less than 15% of the US population. At the root of this distressing disparity is not just the underlying health conditions that we often talk about that put African Americans at elevated risk, but at the root are a host of factors related to structural racism, including poverty, lack of access to healthcare, low-wage employment, and chronic stress. I am so grateful today to be joined by an amazing group of people here in St. Louis who are leading the way in advancing racial equity and advancing health equity. And I would like to welcome them into the room. I will start with Angela Fleming Brown. She's Chief Executive Officer at St. Louis Regional Health Commission. We are joined by David Dwight, Executive Director and Lead Strategy Catalyst for Forward Through Ferguson. Professor Sean Joe, Benjamin E. Young Dahl Professor of Social Development and Associate Dean for Faculty and Research at the Brownschool at Washington University, also Director of Homegrown STL. And Professor Jason Purnell, Director of Health Equity Works and a professor at Washington University's Brown School. I'd like to turn it over to Cynthia at this point.
Good morning again. My name is Cynthia Williams. I am the Assistant Dean for Community Partnerships at the Brown School at Washington University. And again, I have the privilege of saying good morning to 4 of my most favorite people on the planet. So good morning to each of you, and thank you so much for taking time out of your busy schedule to talk with our faculty, staff, students, alum, and also regional community members, as well as extended community. I'd like for each of you, please, beginning with you, Angela, would you please tell us about yourself, your work, how COVID-19 is impacting the populations that you serve in St. Louis?
Good morning, everyone, and thank you all for having me today on your panel. As they mentioned, my name is Angela Brown, and I'm the Chief Executive Officer for the St. Louis Regional Health Commission. And I've been with the Commission for about 13 years, officially took the job as the CEO in February. So I've had the great experience of learning how to lead in a crisis, so it's been fun. The Regional Health Commission is responsible for ensuring that those who are uninsured and underinsured have access to health care. One of the ways that we do this is through a program called Gateway to Better Health, where we provide primary outpatient coverage services to approximately 20,000 individuals that live in St. Louis City and County for care to their primary care providers and other necessary services. We also provide transportation and prescriptions. And our population is really those who are underserved, most needs, many of which have been impacted by the COVID-19 pandemic that has spread throughout our region. Did I miss the question, Cynthia? Was that what you asked me to say?
You did fine.
Okay, thank you.
Thank you, Angela.
Dr. Joe, I think you're on mute, sir.
Well, good morning, everyone. My name is Dr. Sean Joe, and my work focuses primarily on 2 areas. One is the mental health of Black Americans, and the other is the impact of population level interventions to increase the economic opportunities for Black males in the St. Louis region. So a lot of what I'm going to focus on tends to oscillate between those 2 areas, and I'm just primarily concerned about the young Black boys and adolescents and how they're experiencing this pandemic. I know many of them are gaining access to food because many of them are in public schools and those sort of things, but I'm concerned about not only their physical health, but their mental health. But again, the population that I'm less clear about, because the data is hard to get, is what's happening to young men, and particularly disengaged young men from areas of work, and they're not in college or in school. So I'm really concerned about them and young men who are currently incarcerated and the impact of COVID pandemic on them. So those are some of the things I'm really interested in and trying to focus on at this time. So good morning.
Good morning. Thank you, David.
Good morning, everybody. It's great to be here with you all. So I'm the Executive Director of Forward Through Ferguson. We're the organization created after the Ferguson Commission and their study with over 3,000 community members to look at what were the root causes of the disparities and inequities that we see in St. Louis by race. And they set out 189 recommendations, a path forward for how the region could start to change our systems fundamentally to be systems that served everyone instead of privileging some within the region. And so since the COVID-19 pandemic, there's just been, like with so many other nonprofits that have been doing great work in the community, has just meant having to completely reorganize and rethink how we're meeting this moment. So we've been doing some kind of rapid response from a policy standpoint. How can eviction policies across the region change to meet this moment? How, as funding resources are going out, can we make sure that it's done in an inclusive way and not just necessarily going to large nonprofits, again, who often, and versus going to others that may be locked out of funding previously, and just reevaluating a lot of our strategies. For example, we're working on a guidebook, an advocacy toolkit for parents with the school to prison pipeline and out of school suspension. And at this time, when parents have so many other things on their mind, kids aren't in school, that might not be the most pressing inequity for us to work on. So we've just been trying to shift and be responsive.
Thank you, David. Dr. Purnell.
Good morning, everyone. So my day job is as an associate professor at the Brown School and director of Health Equity Works, which has been talking about racial equity and health equity for some time now, and contributing to the regional understanding of health disparities and the social determinants that drive those disparities. But right now, in the context of this crisis, leading something called the Regional Response Team. Grateful to Angela and the Regional Health Commission and dozens of other organizations who've come together and said, we need to have a coordinated response to lifting up and elevating the needs of the most vulnerable populations in the context of this crisis. So also very grateful to David and Forward Through Ferguson for supporting that work. From the standpoint of data and the amazing Dr. Karishma Furtado, who's helping us with newly minted PhD, helping us with some of that data work. We've really been focused on what we call campaigns in this work. So focusing on how do we have a coordinated, dedicated response to homebound older adults and individuals with disabilities so that they're not just getting referrals, but they're actually getting their needs met. Also focused on the unhoused in this current crisis, whether those folks are in encampments or in shelters, or if they need quarantine and isolation services. Just got off a call with partners working on some of the school food programs, and trying to understand how we coordinate our efforts in that, and also working in pretty close coordination with the St. Louis Community Foundation's Regional Response Fund, and some of the work that David was talking about directing resources to a broad array of organizations who can respond to this crisis.
Thank you, panelists. I'm going to jump right into this topic. In an April 8th NBC News interview, an esteemed professor at Washington University, who is also a trauma surgeon at Barnes-Jewish Hospital, Dr. Lori Punch, emphasized the inescapable risk for people in North City and North County because of deep historical disparities and where life is really not supported. How do you respond to one or both of the following statements? Her statement was, the truth is race is not a factor in the coronavirus. Racism is. And she also compared the virus to gun violence. Her statement was the virus and the bullet are both vectors of structural racism. Would you respond to one or both of those statements, please? Feel free to just jump in.
I mean, it depends on how far you want to rewind the tape as to where we start in talking about racism. And I agree with Dr. Punch, and am very grateful for all the work that they are doing in this community to respond to this crisis. Race is an invention of Europeans to justify white dominance and to give a narrative about why white people, which is itself a very flexible and malleable construct, why they should be on top. So it's not surprising that those who aren't on top find themselves very often expendable in our systems. And what we're looking at is the expendability of Black bodies, which is, you know, if you want to rewind the tape to 1619, we can, or we can, you know, fast forward to chattel slavery for hundreds of years in this country, or we can fast forward to Jim Crow laws, or we can fast forward to racial residential segregation, which is still the situation we find ourselves in St. Louis right now. And the policies and the conscious choices of actors at multiple levels of government and private industry that make that not just about people's interpersonal predilections, but about systemic and structural ways in which it is more difficult to have access to resources and opportunities to succeed. And that level of social and economic exclusion from opportunity plays out in terms of health outcomes.
So I'd like to follow up with you, Professor Purnell, and then any of our panelists can join in. Talk to me about some of the very specific structures, the things in the built environment in these segregated communities, in St. Louis in particular, some of the things specific to our built environment that are making us African Americans particularly susceptible to this illness.
Well, I mean, one in particular is a lack of access, physical access very often to things like grocery stores, healthcare providers. So when we tell people to shelter in place and stock up on groceries, and there isn't a grocery store for 5 miles that has anything that you would be able to stock up on. That's just one example of the kind of built environment reality that we're talking about. But we're also talking about things like crowding. Folks who are forced to rent houses, very often sometimes living multi-generationally in those houses. If you have an older adult who you need to isolate, where are you going to isolate them? And if you need to find financial support for your family, and you don't have the opportunity or the option to stay at home, and you're forced to interact with people who may be carrying the virus, who may be asymptomatic in carrying the virus, those are the kinds of structures that we're talking about.
And then I'd like to rewind just a little bit, Angela Brown, if I could direct this to you and switch gears. So we're talking about the physical built environment. Let's talk about our physical bodies. Let's talk about African Americans and the chronic illnesses that we are more prone to that are making us at higher risk for COVID-19.
So that was actually going to be my point. I think when we talk about the impact of this disease in the African American communities, we do target that we are definitely disproportionately affected by diabetes, hypertension, asthma, and other chronic diseases. But that's just a piece of the story. And I think that's why it's important to call out the structural racism here, because the reason why we have those chronic diseases is because of this structural system where we usually, first of all, the lack of trust for the healthcare system, which goes back to the Tuskegee study and other things where we were often treated in places that were not acceptable or definitely not of quality of other standards. Also, when we talk about access, typically African American are in communities that are low income, which means they don't have access to healthcare insurance, which makes it a barrier. Most times the hospitals and the facilities are not in their community, so transportation becomes an issue where they can't get access to those things, which causes them not only to not receive that care, but they're delaying the care until it's in a it is in a way where it's more emergent and it needs direct emergency care. And so, you know, we're dying earlier, which is important because to reach this because of those structural barriers. So I think, you know, Dr. Punch's statement of the racism here is really gets to the root cause of what we're seeing in terms of our overall health disparities, being more impacted by chronic disease and different things, as well as what we're seeing here with this pandemic.
Absolutely.
I'm going to jump in. Oh.
Yeah.
Yeah.
No, I was going to jump in for a second because I think I don't want to lose, and I think we're kind of hitting it, but I don't want to lose the clear point behind this too, which is that she's asking for clarity. Often we're talking about some of the symptoms and we describe it as race and et cetera, but she's saying right now, this is not the symptom. One of the reasons we're seeing these sort of disparate death rates and infection rates is because of racism as the cause. And she says, don't lose sight of this. Don't get masked in conversations about race. Talk specifically about racism and its both historical and present function in our society. So our president talks about the invisible enemy. This is one of the enemy that operates somewhat invisibly, but then you see its impact very physically. And we're beginning to realize that. So, but we also got to take a step back to say, how does this work? It impacts our ability to recognize and empathize and then invest. So when you see history of St. Louis and Homer G. Phillips and when you remove healthcare facilities or you operate with principles that does not empathize or recognize the impact of your work, either implicitly or explicitly, then you're set up these structural systems that produces the outcomes. So this sort of racism is sewn into the geography of places where Black and Brown tends to live, and we're seeing that play out in society. So I think her point is that we're in a position now to dream bigger because this disease is telling us how we all connected. And it says for everyone in the spectrum of thought that if you don't deal with this issue of racism, then we're going to lose sight of when we look back to say, what can we have done to better protect Americans against this pandemic? And what could we have done as St. Louisians to understand that? So our decisions of the past are coming to have an impact on these rates that we're seeing. So again, racism impacts your ability to recognize in others their need, to empathize with others, and then determines your ability to invest in doing something about what you're seeing.
Thank you.
Dr. Joe, you mentioned death and rates, and I do want to bring the conversation a little bit into data. So the role of data has been playing. So we've been hearing a lot of different things. Now, undeniably, unmistakably, the data we do have is absolutely showing this disproportionate rate at which African Americans are impacted, both in terms of the spread of the illness, contracting it, hospitalizations, and death. I did read our colleague Karishma Furtado and her recent article that just came out a couple of days ago about still compromising the disparate impact of COVID-19 in St. Louis, episode 1, how we know who gets sick. I want to talk a little bit about how we know what's happening right here in St. Louis with who gets sick. The last I heard, our death rates amongst African American Black communities was about 4 times as high as in comparison to white communities. That was specific to St. Louis County. In the city, Black residents are about 3.3 times more likely to test positive. Let's talk a little bit about how we're collecting data and the story the data is telling us.
Yeah, so this is both a personal as well as a professional priority, this issue of data. So I think we've now hit the point in our national conversation that we need to collect data and disaggregate it by ethnicity. all right, and gender and those sort of things. But we're also not capturing important data. Let me highlight that first. So there's anecdotal stories, both I know personally and then reading nationally, that we're not capturing how many people are coming in for tests and being denied tests. We have no idea what's happening with that, with the magnitude of that experience and how it's related to the disproportionate rates of death. Because people are dying at home, people are dying undiagnosed, and we're not monitoring in any systematic way the request for testing data, because I think that's going to tell a good part of the story in terms of when we account for the deaths from the COVID pandemic. But America is somewhat maturing in its understanding how important it is to capture detailed data. It wasn't until the 1960s that we moved beyond white, non-white in most of our national data systems, and even begin to be able to add some specificity. So part of this is always related to, again, the corrosive and cancerous nature of racism, which it says, if I don't think it's important to know what's happening with you, why would I even measure who it's happening to? We're just care about white, non-white. And that was our system until the civil rights movement really ushered in a new era of epidemiology, where we began to get much more detail in our data, and that's maturing. So we have to get that level of data into our systems and surveillance, in addition to the data in hospitalization, who's surviving, et cetera. That detailed data information is not necessary just because of a Black priority. It's necessary for a regional priority, because again, this is not an illness that keeps to itself. It does not abide by the principles of racism. It doesn't say, you know, that person's white, so we're not supposed to go over there and touch them and infect them. It doesn't operate that way. So those are some of my immediate thoughts, but this panel is well positioned to answer and respond to that as well.
Yeah, is there any, yeah, Angela, please, yes.
I just want to follow up to Dr. Joe's comment about the availability of the race data. And I think it's important to know that even when this first started, the race data was not readily available. That was something that came out in recent, more recently, weeks of really having our city and county health departments begin to report that race data. And so I think when you think about, we talked about the structural racism and the history of racism and the proportion of the chronic disease in African-American communities. When we look at where testing sites went up in our region, the first one was in Chesterfield. And the last one didn't come in until we were in North St. Louis, which is almost a month into the pandemic, which was April 2nd. And so understanding that and the availability of data, if we would have been thinking that way, I think, and having it more earlier in the conversation to help even think about where we place testing or where resources are available is important in this conversation when we think about the information that we're collecting and how it's being reported and used.
And I think that really gets to like fundamentally what communities are structurally able to be resilient. When we look at the distribution of resources, all of those structural components people are talking about that come into play when we have something like a pandemic, transportation and being able to get to healthcare, actual healthcare being available there, whether your data is being paid attention to and tracked, because what we track is what we care about. And in the city of St. Louis, we're still not able to track by race death rates. Dr. Furtado wasn't able to report that data because it wasn't readily available, so we couldn't even see the disparity there. And so I think that's one of the ways that it plays out too.
David, I have to say, like, the history post-Ferguson, and Cynthia just really connected this really well when we were preparing for this. It was so explicit that we should be collecting data and disaggregating by race. This is the guidance that's been on the books now for 6 years, and not just around health or death, but a lot of things. Talk to me more about what it means for you to have been part of the process, telling this community, this region, how important it was that we collect data and disaggregate by race, and we find ourselves on the knees of this pandemic and not doing that, not having adopted those practices.
Yeah, I think one of the things that the leaders of the Ferguson Commission recognized really early on, Bethany Johnson-Jervois, Starsky Wilson, Rich McClure, and others, were that they existed within a history and a lineage of efforts that had looked at race after these crises that we experience in our community, like the killing of Michael Brown, the murder of Michael Brown. And they knew that we existed within this cycle, right, of us studying the issue and then not having successfully addressed the root causes of it, such that when the next crisis came around, we were better prepared to address it. And that was a lot of the idea, the motivating force behind the Ferguson Commission report. Let's set out these recommendations for what we know needs to change structurally in St. Louis, so that we don't find ourselves another 5 years, 10 years, 15 years with another crisis where Black St. Louisans particularly are bearing the brunt. And it's unfortunate that, you know, 5 years, 6 years later, we find ourselves in that same position. And I think in the way that coronavirus crosses so many sectors of our society, it's also then just further unveiled the way that all of those areas, so data and the way that we're not disaggregating data, again, what we measure is what we care about. And then in many other areas, I mean, some of the signature priorities from the Ferguson Commission report and from the For the Sake of All report, from things about health disparities, about the presence of clinics and healthcare for kids and students as well as for families, about minimum wage and workers' rights. When we know that essential workers, as they're being called now, though perhaps not given that same value previously, are predominantly women of color, people of color, and low-income workers, and just seeing the way that they're now treated as essential, but not necessarily being given those same values and protections. So it's been, I think, frustrating, but also we're trying to see this as an opportunity point to really accentuate what we know, solutions that we know will improve St. Louis, and how we can kind of harness this towards achieving more of those.
I think that was very compassionate of you to say that it's unfortunate. I'd like to take it a step further, and I'd like to say that it's irresponsible, perhaps, that we haven't adopted these practices, knowing that absolutely necessary. And had we adopted them sooner, had we been practicing what, not just data collection, but, you know, racial equity, advancing racial equity, we wouldn't be losing the lives we have right now. I'd like to pivot the conversation and go a little bit back to Professor Purnell and talk about response now. So it's here, it's happening. One of the things we want to ask all the panelists a little bit, one of the things Cynthia and I talked about was, are we surprised by any of this? When we started seeing the national data come across around how this, the burden that the African-American community was bearing, were we surprised by any of it? But I'd also like to talk about our response and what the response has been and what the response could be going forward.
So I don't think any of us who pay attention to this were surprised. In fact, when we had some of the earliest cases in St. Louis County, I called the co-director of the health department and said, how can I help in terms of the social needs that I know are going to be a result of some of the mitigation strategies that are going to be, and just predict it. You know that people are going to be unable to get access to food. They're going to be unable to get rental assistance. So how do we have a coordinated response to that? And that's part of what we've been doing in trying to bring together service providers, trying to make sure that the financial resources are there to support the work. But I also can't speak highly enough for some efforts that Angela has been involved in with the Prepare STL communications campaign, which is made possible through the Missouri Foundation for Health. But the boots on the ground are community health workers and organizers who are going into communities that have been hit hard by this virus, sharing the best information possible, handing out PPE, actually on the ground doing the work, in addition to a number of service providers who are providing food, providing rental and utility assistance, really making sure that the basic needs of individuals are being met. And I am seeing more coordination than I have seen in the past in St. Louis. Coordination is not always our strong suit. We're more likely to create 17 different things and move in 27 different directions. But people have been willing to come to the table to work together across sectors, across organizations to respond to the crisis. And I think that is that's a hopeful thing. What we need to do is build the civic muscle and the civic infrastructure to continue that through this crisis and beyond this crisis, so that we continue to have those common tables where we solve these problems together. But yeah, none of us are surprised. I often say it's a tragedy, but it's not an accident. And there's a difference between those two. The tragedy is the loss of life. And we talk a lot about numbers. We have to remember that there are, as my colleague Daryl Hudson often says, there are people behind each one of those numbers. That's somebody's grandmother, that's somebody's aunt, that's somebody's husband or brother. And they have value. You know, there was a lot of controversy around saying Black Lives Matter a few years ago. And it's being said because for so often Black lives have not mattered. Black lives have been expendable. And we have to finally make choices, make decisions, make investments that back up that slogan with some reality.
Mm-hmm. And very interesting that our expendable lives have quickly become essential to upholding everyone else's life and well-being.
That's always been the case. There's always been this schizoid understanding of Black life in the United States, which says, we need your bodies to build this country. We need your bodies to make this economy move. We need your bodies in nursing homes and doing home care. But once we've used them, they're expendable. Once we're done with them, we can put them to the side, and we can create these sort of idiotic mythologies around shiftlessness and laziness among a people working 3-4 jobs to keep food on the table and not have the same opportunities. So, you know, I was talking to Jamala Rogers, texting with her not too long ago, longtime Black activist in St. Louis, and both of us thinking about James Baldwin's quote that using some older language, to be a Negro and to be conscious is to be almost in a state of rage all the time. If you're really cognizant of the ways in which people are separated from opportunity.
I'd like to follow up with the question to Dr. Joe. Dr. Joe, would you please speak to the structural barriers that exist specifically for the young men that you serve, age 12 to 29? Would you speak to that? And you're on mute, sir.
I mean, this esteemed panelists know it very well. You're talking about, first of all, Black boys, and predominantly most of them North City, North County, the access to food, whether or not their parents who were in jobs that were either not on par with any type of wage growth, you know, that would sustain them. These are all vulnerable children and vulnerable families, vulnerable males. So what I've seen also, and I think this is incredible just to watch the amount of the community infrastructure that's began to, whether it's the Urban League and other groups and the school districts to ensure that food was on the table where they could, or groups who are coordinating healthcare and access and trying to mitigate the spread of the disease. So those groups, I think, are particularly vulnerable, but I do think there's a large number of community support that's being marshaled to try to help and to in the way that it can be helpful. But again, it's hard to overcome something that's been built intentionally in this way. But I'm more concerned about the 16 to 29-year-olds who often, we operate with a principle in our nation about who's deserving of our goodwill. And if you go back to the idea that we have also, just like the American dream, we also have the approaches to racism that says, well, not everybody's worth our goodwill because not everybody is a body of equal stature. So my point about that is that you have men in particular who we say, men, men have to take care of themselves regardless of whether or not they have need, regardless of what brought them to that context, what is their contribution to their circumstances, or what is the structural contributions that's sewn into their geography in terms of opportunity or lack of access or anything like that to their circumstances. So I'm really concerned about those men, whether or not they're homeless and where they're having access, if they're in shelters and then they're too close and they're spread in shelters, whether or not they might, for a proportion of them, are incarcerated, and what's happening there, because disease, has to be brought in. It's not going to come from in and, spread out. That means it's being brought in and what's happening to them. So those are the two different groups that I think we have to be concerned about. But again, we lack the data. I've been searching a lot for this data, even the employment and economic impact of what's happening. That's another angle of this that we're going to have to pay particularly attention to, because then that determines people's access to food, shelter, the ability to homeschool. How many computers, as a parent who's going through this right now, when my daughter decided that my laptop was capable of drinking lemonade, I was able to get another computer. But not every parent has that resources. They're trying to homeschool from the phone. They're trying to get Wi-Fi. So, and I just think that these males of different economic statuses are vulnerable, and we really don't know what's happening to them. And I'm concerned about that.
Thank you.
I want to, if it's okay, I'd like to bring in another person who's not right here per se right now, but just recently, our dear Reverend Starsky Wilson came out and said, when Black people are dying, Black people should be in charge of the healing process for what is killing them. I want to talk about that because some of our guests are asking about the role of whites and Black leadership and white leadership and the role of philanthropy, which is often white-led. Talk a little bit about our response, our short-term and long-term response being led by Black people, but the responsibility for addressing racism and racial equity being the responsibility of this entire region.
I mean, the reality is the control of resources is unequal. And very often the people who control the resources don't look like the people who are bearing the brunt of crises like this. I applaud Reverend Wilson for lifting up the role of Black philanthropy and lifting up the role of directing funding to Black-led organizations. But the reality is we're dealing with the magnitude of the problem that we're dealing with is going to require resources that are significant. It's going to require this federal funding that's coming down from the CARES Act, for instance. It's going to require leveraging private philanthropy. It's going to require state level funding. And what we have to get serious and sophisticated about is using data to highlight the areas where people are going to be the most vulnerable. Like Professor Joe said, employment is certainly one of those things. So is homelessness. We know that once these moratoria are lifted around evictions, we're going to have a flood of people who are not able to stay in their homes. So how do we use the best available data while centering the most vulnerable populations to get to some investment strategies that actually help, and not just, I would add, not just give people jobs, but give them wealth building opportunities, give them some part ownership in some of these companies that they work for. As a strategy, we were just on a call yesterday talking about employment with the community colleges and some partnerships with industry, between industry and community colleges, to give people pathways and access to jobs in industries that we know are likely to flourish once we get out of this current crisis.
Yeah,
it's interesting. Oh, go ahead, David.
You can go into it.
I was just going to add, I think it also matters who's at the table making these decisions. When Ferguson happened, you know, that was a realization that, to many in St. Louis, oh, we have an issue with race. We saw a lot of movement towards adding racial equity to missions, people rethinking their board structures and having more diversity on their boards. And then we got into the second crisis with this, and kind of we all reverted back to our old ways of let's get with who we know and make these decisions, and not considering the people who are most impacted by that. And so when we think about having a racial equity framework lens, that is important to have people of color, other diverse groups at the table when we begin to disseminate these resources. And so Jason mentioned the CARES Act and some of the federal dollars that are coming to our region. And even when Parsons put his team together, it was first all Republicans, you know, then he added some Democrats. But then how are community people given impact? Those who are being truly impacted by the disease and the pandemic, who are having to try to figure out how to work virtually with less access to internet, computers, and how to teach when they might not have the resources and the tools to do that. How do you come out of this crisis when, you know, they have been postponing your utility bills, but at the end do now you have to pay the full amount and you haven't had a job? And so what is our response? And we don't have these people at the table helping to direct how these fundings are spent, nor are those type of things considered in the process of the thinking. And so I think it's important as we look forward to ensure that the voices of people who have impacted are definitely included in the decision-making process. And we've done some work with community participatory budgeting. You know, the county has a recast initiative and other things, but to truly be impactful, to really, I think, starting to address wealth and some of these long-term economic issues in our region, you know, we need that voice that's available. And so I know, you know, we have some, our white peers and constituents on the lines, and how do you use your privilege? And I think that's ensuring that other people are at the table, that you're not at the table that you all look alike and have kind of group think, but really spread out to ensure that diversity.
Dr. Joe and David?
Yeah, I want to follow right where Angela left us, which is that we know this is a difficult time for families all across the country and in cities similar to St. Louis. And I'm just hoping that this is not a pre-pandemic sort of conversation and how people are receiving this versus it's a post-pandemic structure that says we have a rare opportunity to tackle this in a very different way in terms of preparing for the future. So I took Starcy's comments as we got to strengthen the infrastructure that's closest and best understand the communities that are disproportionately impacted. But this pandemic is reminding us that we're not isolated, that we cannot operate as if under these structures of racism. And we have to think now, take this rare opportunities to just rethink big structural issues in terms of how we plan, how we coordinate, what are those common tables to address a lot of social as well as physical ills. And can St. Louis step into a bigger framework out of this versus coming out to be in the same sort of conversation 6 years later, because as they're projecting, there will be other sorts of threats like this. So for white colleagues, and I'm watching some of the chat, folks to step into it with the idea that we have to have bigger common tables, clearer investments, because the pandemic is reminding us that there's a social connectedness or socialism. Wow, I said that word, that's right. There's a socialism to how our democracy operates, and we have to move and think big ideas about how we coordinate these things going forward. Because when you see rates of infection of up of 710 in Black communities for COVID, and then you have St. Peter's and others with rates of 110, it's telling you that you're not protected just because you're in one geography and another. Is that we have to step up and do something much more bigger and more coordinated at this time. And that means, as Angela said, acknowledging that you must recognize that you've got to put other people at the table and deepen the infrastructure for the future, so we can be able to act better, coordinate better, and have a better impact in preventing pandemics and epidemics and the type of social ills that we see. So
I think, agreeing with everything that people said before, and the other thing that Cersei's article makes me think about is what are we learning to do differently next time, right? If we note that awareness was built, people became aware of race, like Angela said, and started using the language of racial equity 6 years ago, and we find ourselves 5 years later not that much more prepared as a region to actually ensure equity for our residents, then what does that call us to do differently in the future? And I think a huge part of it that goes along with the people of color and Black people at decision-making tables is, are we taking a charity or a transformation approach to our change work, especially as we're responding to the pandemic? There are absolutely a huge amount of immediate needs that we need to be meeting. You know, people need food, they need shelter, et cetera. And St. Louis is often rated as one of the most charitable regions in the country. You know, for the last 10 years plus running, we've always had generous people who want to donate their money for direct need. And yet we find ourselves, you know, decade after decade, still with these structural inequities and structural racism. And so I think one of the things that white people can do is that when they see a need, not just to think of it as an opportunity for charity or to give money, but to see it as an opportunity for transformation and to see their kind of sphere of influence as just as important of a place for change as like that place over there in North City and North County, because the housing policies in St. Charles and Wildwood are as connected to the inequities that we see historically as you know, any other kind of immediate need kind of thing that we might think about. And so shifting the workplaces that white people work at to be ones that include policies for equity and access and inclusion and are well paying, that white communities are shifting their housing policies that are often exclusionary and lock people out of opportunity. Those are some of the ways that we can really powerfully transform versus get into this kind of charity cycle.
So you just hit upon something really important, and it's policy. So we're gonna pivot to some questions from our audience. Our audience has been extremely active and very patient, and we could talk about this for another hour, but we have about 10 minutes, unfortunately. So these conversations will continue in other platforms and other ways, but for the remaining 10 minutes, we're going to go to our audience. I want to hit up something that David and Dr. Everyone's been getting at is policy. So one of our guests, Harvey Fields, has asked about structural and policy interventions and changes that we need to see. When Jason Purnell mentioned the lack of asset building opportunities and policies for African Americans and how that's deeply embedded in this problem of both racism and racial equity, you know. So talk to us about policy interventions looking forward, large scale public health interventions, big P policy, little p policy. Talk about that.
Well, I meant to mention this earlier. We need to invest in our public health infrastructure, period. One of the things that we got caught in this crisis with was an underfunded public health infrastructure at the local and the state level. We've got folks collecting COVID-19 cases on paper and faxing it between local authorities and the state in the year 2020. So that's the most basic level. We need to, at the local, state, and national level, do a better job of investing in public health infrastructure. But to some of these points that David was making, the thing you have to be aware of, though, is that we've got cumulative disadvantage. This isn't just a slice in time where we look at African-American families today and say, gee, there's a wealth gap, or gee, there's an income gap. What we're talking about is generations of folks who haven't been able to build that home equity in the kinds of places that David was talking about and transfer that wealth on to subsequent generations and have the kind of wherewithal to weather a crisis like this, because that's what wealth allows you to do. There are people right now on furlough who are able to draw down on 401k accounts, on savings accounts, because they have the assets in place. So we have to have, one of the policy strategies has to be around supporting asset building. One of the things we were doing before this crisis hit was around child development accounts for babies born in the state of Missouri. And hopefully we can get back to that. But that's having a defined asset at birth for children as just one of those strategies for making sure that we're not just talking about the income that comes into a household, but the ability to build wealth, which is so central to a lot of what we're talking about right now. The ability to control one's destiny because of investments in that future.
Jason, I have to piggyback on that because that's the next wave of the pandemic for me. It's not just our bodies and our health. The next wave is minorities and women will be the hardest hit for layoffs. Racial equity will not play into that decision making. Black people own, in terms of wealth, $1 to every 10 that white families own. The Fed says that Black families maybe have emergency savings on average to survive 5 days. Okay, so the next wave of this pandemic is economic justice or injustice, right?
But I slightly differ. I think those are critically important pieces, and I know that's coming. The next wave of the pandemic is going to be the level of grief and behavioral health care needs that families have to deal with.
Yeah.
That there's so many people who are dying alone, or so many first responders who are dealing with the death of people they don't even know, and they have to be the only one to hold their hands when they're dying. So similar to what's happened with the physical health system, we got to prepare and have policies that are going to prepare us for the behavioral health care needs. That's going to be at a kind of a tidal wave. I don't know if it's going to be at epidemic levels, but we've already had 5 to 10 years of growing deaths of despair in this country, and not only in urban settings, but also in rural settings. So this number of people who are going through illnesses that's leaving them physically impacted for long term, as well as those who are dying, the behavioral health care system needs new policies that will allow them to prepare for that. And what I'm saying is we need, similar to what we have with the CARES Act, with the economy, we're going to need that level of infrastructure and to get ahead of putting in infrastructure now for the behavioral health care and that tidal wave of grief and trauma and complex grief, because it's not just going to be normal grieving that's about to happen. And because we are so focused on our physical health right now, many people are not fully getting the burden of the grief that they're going through. But once we get back to some sense of normalcy, that grief is going to be there, that guilt, that anger, because you were not there when that person died, or you were not there when that person was illness. So I think the economic piece is coming, but we cannot lose the fact that our emotional health, we're going to be, and complex grief is going to be the next tidal wave. And we got to prepare for that now, because we could do something now about that.
Yeah.
Angela, we've had a couple of really prolific guests who have asked several questions. I want to just give a shout out to Jimmy Briggs. I think we're going to have to follow up with him offline. He has some great questions. He did ask about messaging, the critical, like misinformation and messaging. And I want to just ask you about this, because I know Prepare STL, part of it's like how it came together was to talk about how do we message specifically for the African American community. Can you talk a little bit about the role of information, misinformation, and messaging?
Yes, and I also want to touch on one of the questions about some learnings from Paris. And one of the things about what makes it so unique is that it's community-led. And so some of our partner organizations, they have a network of community health workers, and they have different variable names, but they are made up of individuals who live in the communities that we're targeting. They live, they play, they know the people, and they help design the messaging, which was pretty important, and even develop the name of Prepare STL. And so a lot of the learnings that we have, and one of the things that we want to share in our model is partnering with community to reach the community, and the importance of having that lived experience as part of the planning process. And I think that's what has made this work very effective, because they took Prepare and they said, you know, a lot of our communities are not, they know about the disease, but they're not at a level where they can begin addressing and taking the actions that were needed to stop the spread of the disease. And so how do we get messaging to them to help them understand, first of all, that, you know, Black people were dying from the disease. Black people could get the disease. That was definitely a myth. that was started long before this. And also understanding that many of us have to work in jobs where we are considered not essential healthcare, but still essential workers because we're at the restaurants, the grocery stores, and social distancing is not something that we can always practice and stay at home. And so how do we begin to address that? So definitely having that, I think, lived voice at the table really helped design this and move us to the next level where we were able to move quickly. It took us 3 weeks to get this in action and out, to get information out to you know, that missed population that our health departments weren't able to address when they were first getting started. And I think it's very important what Dr. Joe was saying about mental health, because that's definitely our next phase of work is thinking about the grief, the bereavement that's going to come from this, just getting back to normal. How do we begin to have that targeted mental health messaging, as well as that long-term economic impact, because we know a lot of our communities will be impacted by this, from the layoffs, the furloughs, and how do we begin to help them restructure and get back to what we consider normal. Hopefully we define a new normal for us, but in terms of how we move forward. And so, you know, that's very important, because when we think about the communities that are most impacted, a lot of the access to information is not available for them. So we go straight to websites. You get on these that has very dense information, hard to find the key takeaways. And you have to have access to internet to even get to those. And many of their websites are not necessarily usable on the cell phone, which most people have access to. And so how do we get boots on the ground in order to get information in places where people are, where people can receive it in the message that they are able to receive?
So we have 2 minutes left, and I'm hoping that our panelists, thank you so much to our audience and the participants, such a wealth of knowledge and information from our panelists. We are going to share a lot of the resources that we referenced in this conversation. We will if you registered for this panel, you will receive an email in a couple days with a link to a recording of this, as well as some of the articles and statistics and data and resources that we've been mentioning. But with the small amount of time we have left, I'd like to ask each panelist to take 30 seconds and talk about the biggest takeaway. There's so many people on this call. They all want to know what they can do. But really, what big picture, what is the key takeaway that you want to leave us with?
I think I want to piggyback on something Angela just said, which is that we need a better conduit from the grassroots to the grass tops. We need, and that's very often those who sit at the grass tops level shutting up and listening. Don't just do something, sit there and listening to what that lived experience is and letting that shape what the response is. And Angela's had to do a little teaching of me on that in the past several weeks, because when you sit on perches, you sometimes think you have answers that you don't have when you're on the ground. And I think that is so critical as we're building these new civic muscles. Part of that muscle building has to be, how do we connect lived experience to some of the resources and investments that live at the grass tops?
Excellent.
Yeah, and I just want to throw in that the importance of voting. I know we're all looking forward to November and many of the other elections. And as we talk about grassroots and really coming together, the importance of our voice as part of that conversation to really help move our message and really help ensure that we're getting the correct direction and investment in our communities. I think it's very, very important.
And I'll follow up with the importance of the 2020 census. I think as we're going through the pains related to the pandemic, we could also, and it's tradition that Blacks go through this sort of pain, but we also act under pressure. So this is the important time, a unique time for us to increase our self-response rate for the census, because that sows in the seeds of whether or not we're expanding equity and access to not only healthcare, but schooling and our political power. So take the time now before we're impacted by the relaxation of these stay-at-home policies. Now is the best time to turn out St. Louis in the census rate right now, because it's fully in the hands, phone, online, to really complete that census. So that's my biggest takeaway for right now.
I think my biggest takeaway is that, like, two parts to it, is that St. Louis needs to learn to walk and chew gum at the same time. So we need to have better coordination and collaboration across the different types of community change, between like meeting immediate need to like midterm and long-term like structural changes. And I totally agree with what Jason and Angela said about connection between like grassroots voice and people that are in grass tops decision-making structures. And then just that we need like fundamental changes in St. Louis, and we can't settle for anything less. And we can't allow things to go back to normal. We need to be creating the kind of St. Louis that we want to see, and building the power to do it.
So the ramifications from this pandemic are going to reverberate for many years to come and into the next generation. When we can, especially as we consider the loss of life, as Dr. Joe mentioned, bereavement, the grief, the loss of livelihood in the Black community for the economic toll this will take. This moment is marked by many things the coronavirus brought with it. Devastation, grief, loss, challenge, tragedy, but also the opportunity, the connection, community, awareness, again and again, awareness. And I want to leave with, hopefully, above all else, that it has brought with it is the will for change. I want to thank all of these panelists. People are asking for a part 2. I know this conversation will continue, and we hope that you all will continue to lead in these spaces. We deeply, deeply appreciate your leadership in our region and in these very difficult spaces. It is absolutely necessary. Cynthia?
Thanks to each and every one of you for your real talk, for your bold talk, for your candor. I appreciate each and every one of you.
And Gary Parker, if you're still around, is there any last remark you'd like to make in addition to maybe